I'm going to be talking about pediatrics, including normal bladder function in kiddos and healthy bladder habits, and then some of the common problems that we would see in children in pelvic physical therapy. So things like bedwetting, daytime leakage, overactive bladder, and dysfunctional voiding. So just as a review on how the bladder works, the bladder is meant to help fill and store urine. Urine comes from your kidneys. Your kidney's job is to help to filter out your blood, to help with chemical and fluid balance. So urine is the waste product. It comes, it fills your bladder starts to stretch. This is the normal function. And once your bladder reaches a certain capacity, that's what triggers your brain to tell you that, hey, it's time for me to go to the bathroom. I need to get going. So that's when you make way for the bathroom, sit down on the toilet, and then once your brain knows it's in the right position and right time, then it's going to, your pelvic floor sphincters are going to start to relax. Then your bladder is going to start to contract to help empty your bladder out. Once all the urine has been emptied, then your bladder can relax and your pelvic floor starts to contract again. And it's worth noting that even after your bladder is empty, so to speak, it's not always fully empty. So there's always a small amount of urine left over after we finish voiding. So that's how a normal bladder should be functioning. But obviously with infants, those are skills that have to be developed by the body. So in infants, the bladder doesn't actually stretch very much. As soon as it starts to fill with urine, there's a reflex of the bladder that just squeezes the urine right out. So there's really no capacity of the bladder, and that's why infants tend to urinate so frequently. But with time, the sphincters and the pelvic floor muscles start contracting. When those muscles start contracting, then that helps to teach the bladder that it needs to actually stay relaxed. So these two areas, the pelvic floor and the bladder, are actually antagonists. They don't like to work at the same time. They need to be working opposite of each other. So that's something that the body is developing in infancy. And just like with muscle development of your hamstrings and your quadriceps, it's important for your bladder, which does have a muscle in it, to learn to store and stretch as well as contract. So that's one reason why it's really important to have good fluid intake, is so that way the bladder is learning to store and stretch, and then when it's time to go to the bathroom, it will contract and squeeze everything out. And so by age 4 or 5, the bladder has actually quadrupled in capacity. So that's why the frequency of urination can go down. It's usually not every hour like it would be in an infant. Then by age 3, you can really expect full voluntary control of urination, meaning that the brain is more in control, the person is more in control of what their bladder is doing. And then it's not until age 4 that we can really consider that the child is going to be actually independent to toilet all by themselves, meaning get to the toilet, undress themselves, sit on the toilet, go to the bathroom, then stand back up, dress, and flush the toilet and wash their hands. There's a lot of process that has to go on. And so by age 4, we really are going to consider that that child's going to be independent in that. So for pediatric norms is in terms of how often we are going to urinate. In the first year, it tends to be about 20 times a day or hourly. Because remember, the bladder is not storing anything really. Then in ages 1 to 3, it tends to be about 11 times per day. But remember, the volume is starting to increase. So the urine production is increasing, obviously, with increase in size of the child. But the bladder is also storing more and more. So each void is going to be a little bit bigger. And then by age 12 is when we're really going to expect to be the child to be more at an adult normal, which is about 5 to 8 times a day. So with nighttime control, usually after a child is dry during the day, the nighttime will follow about 10 months later. It's usually fully developed by age 5, but about 10% of 6-year-olds still leak urine at night. And we're going to talk a lot more about bedwetting in a little bit. So good habits, hydration is really, really important for everybody, not just for kids and pregnant women, and it really is important for everybody. So with children, remember, we're trying to teach them that their bladder needs to fill and empty. So kids need to be drinking throughout the day, and we recommend 6 to 8 drinks a day. Now, that amount is going to change. Obviously, you're not going to be giving a 3-year-old a giant glass of water. So we tend to figure that for the total amount of hydration per day, we want about 1 ounce of water per kilogram of body weight, or take a person's body weight in pounds, divide it in half, and that's how many ounces that you're gonna want to drink. Water is best for hydration, but it is okay to dilute fruit juice, like apple juice and white grape juice tend to be the most friendly on the bladder. We tend not to include milk in this hydration. Obviously, milk is still good. It's nutritious. We're not saying don't drink milk, but I wouldn't include it in the actual fluid intake. Dehydration for anybody really, it's going to lead to poor stretch of the bladder, which means the bladder's not going to have a great capacity, so it's going to be a lot more overactive, most likely. Dehydration is also going to concentrate the urine, which makes the bladder more irritated, and therefore you want to go more frequently. So it's really important to make sure that your kid is getting plenty of water throughout the day so that bladder can stretch and empty, but also to make sure that urine stays with good concentration. So bladder irritants is a big one. What the kids are eating and drinking that might irritate the bladder more. So caffeinated drinks, typically most kids aren't drinking a lot of caffeine unless it's with soda. I will mention that a lot of people don't realize that there is caffeine in Starbucks Frappuccinos and even the refreshers. A lot of people think, oh, that's just a fruit juice. No, it does have caffeine in it. And I have had several, usually teenage patients coming in saying that they do drink a lot of Starbucks Frappuccinos and refreshers. So that's one thing to consider. Another big one is chocolate. So chocolate's in a lot. It's a sweet treat. A lot of people really like chocolate. Children love chocolate, and that can be a bladder irritant. So that's one thing that you want to consider. Carbonated drinks is another one. And then some of the things that are irritating to some bladders are things like citrus fruit, sugar, artificial sugar, dairy even can be an irritant to the bladder. Tomato products and spicy food. We're really looking at what is acidic and what is going to cause the urine to be more acidic, and therefore the bladder gets more irritated and is a bit more eager to get that urine out. So potty training. Now, I don't claim to be an expert in potty training, but I feel like there's several good tips out there to keep in mind. One is, when is your child ready? So it's typically between 18 months to 3 years old. You want to see that your child can keep a dry diaper for 1 to 2 hours, usually more towards the 2-hour mark. That they are fully capable of using the toilet. They can sit down and they can stand up. They have core strength to be able to sit on the toilet for a few minutes. That they can follow directions. Are they even aware that their diaper is wet, or if it is soiled and poopy? Can they tell you that? That's a big one. You really have to make sure that everybody's on board, that all caregivers, and that's not just the parents, but that's anybody else who might be caring for the child, babysitters, grandparents, daycare, nurseries, it's preschools. You need to be aware of what the policies are with those, but also what are they going to be able to assist with. And everybody really has to be ready for accidents and mentally prepared that they are going to happen, and they're going to happen a lot. And so just make sure that you're ready for it and that you're going to be okay with it. And try to avoid stressful times like moving house or welcoming home a new baby. I know a lot of moms think, well, I'm home right now, it's a perfect time, but it's a big transition for kiddos, accepting a new younger sibling in the house. So it's probably not a great time to potty train. So when you're starting potty training, you want it to be a very positive experience. So you've got to be happy about it. You got to be excited about it. Make the whole family excited about it so that the toddler can be excited about it. Talk about pee and poo. Don't make it taboo. And I had no intention on making that rhyme, but so it did. And come up with words that you're going to use consistently so the child doesn't get confused between caregivers and parents and school, that everybody's on the same page, and it can make it easier for the child. Have the child watch family members, watch you, watch your partner, watch other siblings, go to the bathroom, make it a normal and positive thing, that it's not a scary thing, and that it's something that they're going to be familiar with when it's their turn to go. Use reward systems as you're comfortable. Every parent's going to be a bit different on what they're comfortable rewarding their child for. But again, make it consistent and start off by just rewarding them for telling you when they've gone in their diaper. It doesn't even have to be that, oh, do you need to go? If they just tell you, hey, I have in my house, we say, oh, I have a wee butt. And so whatever works for you and your family to help the child say, hey, something's going on. My nappy, or sorry, I say nappy because my husband's British. So, oops, where did I have managed to go all the way back. Sorry, guys. There we go. So yeah, in our house, we use the term nappy instead of diaper. So anyway, so help your child sense wetness. So that's a big one. Diapers are very absorbent, and so they've been wearing them since day one. So it can be a very different thing for a child to understand when they are wet. So it might be wise to occasionally put a folded paper towel in the diaper so that way they can help feel that there is something different when they do urinate in their diaper. But do make sure that that's not something, because it's not as absorbent, you have to check it a bit more frequently to make sure their skin stays safe. So you can also take a poopy diaper to the potty, and if you're able to, drop some in the toilet just so the child knows, hey, poop belongs in the toilet, and make it a big thing that they're taking it and they're going to get to flush it down the potty where the poop needs to go. So whatever you can do to really make it a positive experience is important. So some of you might be watching that have kids with special needs, and I think it's really wise when you're thinking about potty training to really talk with their support team. So there might be doctors and specialists, different therapists, ABA, teachers, preschool teachers, psychologists. Really try to bring everybody in and see and try to get on the same page of when your particular child might be ready to start potty training and what are going to be the barriers that you might find for your child. I find that the other parents with children of the same diagnosis can be very helpful, and also, there's usually lots of resources out there if for the more common diagnoses like autism or Down syndrome, that you're going to be able to find resources out there for potty training these children, because we can't expect it with most of them. So some of the common things that we see in pediatric pelvic physical therapy and some of the common problems that a lot of parents might find with their kids is bladder leaks. So a big one that people know of is bedwetting. So bedwetting occurs because the bladder isn't stretching enough, and it might be reflexively contracting as soon as it feels a stretch. So that might be a cause. The child might be producing too much urine. We're going to talk a little bit more of that in a second. And or the body is just not sensing when the bladder's full and waking the child up. and telling them they need to go. Some of the common things that bedwetting is associated with: constipation. You're going to notice that constipation is a general link in almost every single bladder problem that I talk about today. Constipation is a big one. Urinary tract infections or bladder infections can definitely contribute. Diabetes, whether it's been diagnosed or not. Sleep disorders. So when we sleep, our kidney production slows down. And there's a hormone that is put into the body that helps to slow that kidney function down, so there's less urine production. But if a child is not getting adequate sleep, if they're not reaching deep sleep, they're not going to be producing this hormone. Therefore, kidney function is going to stay high, and the child's going to be producing more and more urine than their bladder is going to be able to take. There is a strong family link with bedwetting. So if I believe the stat is if one parent was a bedwetter, a child has a 40% chance of being a bedwetter. If both parents were bedwetters, they have a 70% chance, or maybe even a little bit more chance of being a bedwetter. So there's a strong family link in that too. So daytime leaks, when the bladder is leaking uncontrollably. There are a few different types, which this is the same for adults. There's stress incontinence, when a physical exertion like a cough, a sneeze, running, jumping, sports. A big one's gymnastics. Get a lot of gymnasts that come in with stress incontinence, causes a small or a large leak. Then there's urge incontinence, where you get a bladder leak with the urge to go. And then you can get mixed incontinence, where you get a little bit of both. The common things associated with daytime leaks can also be constipation and urinary tract infections. So some of the simple strategies to help with bedwetting, first of all, is 1, limit fluid 1 to 2 hours before bed. Make sure the kid uses the bathroom right before bed. Next is limit bladder irritants and salt intake. That list that I talked about before with hydration, make sure that those things are not coming, especially right before bed. But even if the body has ingested a lot of salt, that can increase fluid, and then the kidneys are trying to work harder to help excrete that. So you might want to look at what your child is eating and drinking. A bladder diary is a great idea because you're going to be writing down how much a child's drinking, what they're drinking and eating, as well as how often a child's going to the bathroom and if they've leaked or not. So you can on your own just try to draw some correlations that might be causing the bedwetting. If you do suspect your child could be constipated, then you want to go see your doctor. If there's no change with some of these simple strategies, you probably want to go see your doctor too. For daytime leaks, some of the simple strategies that you can use to help eliminate daytime leaks is make sure that your child always takes adequate time to empty their bladder. Monitor their fluid intake, make sure that they're getting adequate amount of fluid, and there is a happy medium. So there are children that sometimes, especially if there's a history of diabetes there, they might be drinking a lot of fluid to help maintain homeostasis. So so you have to watch how much your child is drinking. Limit bladder irritants again, do a bladder diary, assess when they tend to be leaking, get a good idea of when it's happening, especially because if you do go see a doctor about it, you want to be able to give this kind of information to the doctor. And then look, are they going often enough? Kids get distracted. They love to play. The last thing they want to do is have to stop and go to the bathroom. So it's important that you track how often they're going and make sure that they are going and that they're listening to their body when they need to. So for bladder leaks, some people will ask, well, are pelvic floor exercises going to be appropriate? A lot of times, yes, but not always. And with children, because it's a lot harder to understand what's going on, I highly recommend not asking children to do Kegel and pelvic floor exercises right away without some kind of medical advice or supervision. Strengthening is not always appropriate, and we might need to learn how to relax the pelvic floors more than the pelvic floor more than anything. So if you suspect that there is a muscle component, you or the doctor, I would highly advise getting to see somebody like me, a pediatric pelvic physical therapist. And one of the tools that we use is something called biofeedback, which we're going to talk a little bit more about in the next lecture next week. There are lots of great exercises that do help with pelvic floor health. So core strengthening exercises, stretching exercises, breathing exercises. I'm going to go through a lot of this in week 3 and give you guys a lot of good ideas of fun activities that children can do that promote good pelvic floor coordination. If you do decide you do need to go see the pediatrician, they're likely going to test your child for a urinary tract infection with a urine sample. They're also hopefully going to be looking for constipation through an x-ray. That's a big one. In the pelvic PT world, or pediatric pelvic PT world, we are always very skeptical about constipation. Even if a parent says, no, my child goes every single day, they don't strain, and the consistency is not hard, there's still a likelihood that they could be backed up and you just don't know it. So I would always suspect constipation until it's been ruled out by an x-ray. Your pediatrician might refer to a specialist like a urologist or a gastroenterologist, or sometimes a pediatrician might refer straight to pelvic PT if they think that there's a muscle component that a therapist can help with. And then there's various medications that might help with bladder leaks. Overactive bladder, this is something that's going to happen across the lifespan. It's when somebody is too urgent or too frequent with their bladder emptying, and it can be present with or without urinary incontinence. So urgency is when you cannot delay the need to go to the bathroom. We should be able to stand in line in the bathroom if we need to, or finish what we're doing before we need to go to the bathroom. But if a child finds that they can't, then we would consider that to be urgent. Frequency is when the desire to void occurs more often than is expected. So usually with something like overactive bladder, the bladder is not stretching quite enough, and it might even be reflexively contracting, which could result in a leak. Bladder urge should, as the child ages, it really should become less and less of an emergency. Don't let urgency and that running to the bathroom become a habit. As they get older and they seem to have more control, then really let them gain that control in a healthy manner. Again, we don't want to let them ignore the urge because it is important to empty your bladder, but we don't want the child to always think of bladder urge as an emergency, because that's going to lead to problems down the road. So a simple strategy for overactive bladder is going to be, first, if the child says, I need to go to the bathroom, then stop what you're doing. Have the child take some nice deep breaths, maybe 5 or 6 deep breaths, maybe even sing a little song, and then walk calmly to the bathroom, because we need to teach the bladder that it's not in control, and that it is under control of the individual. And so you need to teach the child by slowly getting them to calmly walk to the bathroom is important. Those deep breaths are a really important strategy. And that's something I'll be demonstrating in the week 3 lecture. At times, bladder retraining or timed voiding may be necessary. That's something really that should be done under the guidance of a medical professional like a doctor, or as physical therapists, we also do that a lot. And there are cases where medication is needed for overactive bladder. So the last major bladder problem that we tend to see is something called dysfunctional voiding. This may or may not be associated with leaks, but what it's going to manifest as is an abnormal urinary stream where it's slow, it stops and starts, it splays abnormally. Hesitancy, so if a child has difficulty initiating the urinary stream, or if they feel like their bladder empty or didn't empty all the way, the flow stopped too early and they still feel like they need to go. Or post-void dribble, where the flow stops, you wipe, you get dressed, and or you even just simply stand up off the toilet and there's a little bit of a leak right afterwards. That's another sign of dysfunctional voiding. The cause can be an anatomical abnormality, or it could be a poor relationship between the bladder and the pelvic floor muscles. Remember, those two muscles are antagonists. They don't want to contract at the same time. But in dysfunctional voiding, it could be the case that they are, in fact, contracting when the other one is contracting, which results in a poor urinary stream. Some simple strategies to start off with, if you notice some of these things with your child, is make sure that your child has plenty of time to void. Don't rush them. Don't encourage them to strain and push their urine out. If it's important that they try to sit on the potty. That does include boys. If they're having these problems, have them sit down, because that's a great way to get the pelvic floor muscles to fully relax. You can try deep breathing activities or relaxation activities with them. Make sure if they are sitting that their feet are fully supported. We're going to talk more about toileting posture next week with our bowel lecture, but just as a side note right now, for bladder health, it's important that their feet are fully supported. So watch out if your child is using a big adult potty. I do see a lot of teenage boys with these problems, and so we end up working a lot on toileting posture and breathing activities, relaxation activities. If these problems persist, it's really important to see a pediatrician to make sure that they rule out any of those anatomical abnormalities, neurological causes, and they might end up referring you to physical therapy. So to kind of tie up everything, is one thing you might have noticed in a few of the common bladder problems is constipation's a big one. Like I mentioned, kids can have a regular and soft bowel movement and still be backed up. So really an x-ray or any form of imaging is going to help us rule that out. And so it's an important aspect of what we do. We do a lot of constipation management. And the reason constipation can be so bad to the bladder is because the bowel filling up with stool will press on the bladder, which can either limit its capacity or it could dull its sensitivity, and then the child just does not realize that they need to urinate. So next week we're going to be doing a lot more constipation work.
Yeah, but that's once.
Talking about that. So join us next week.